When you think about your health, what comes to mind? Probably things like doctor's visits, prescriptions, maybe your gym membership. But what if I told you the most powerful tools for a long, healthy life aren't in a pharmacy at all? What if they're hidden in plain sight all around us? Today, we're going to open up a totally different kind of health toolkit. And trust me, what's inside is going to change how you think about well-being for good.
So let's just start with a number. 20%. Take a look at it. What in the world could that be? Well, this single number, it completely flips the script on how we should be thinking about health and how long we live. Because that 20%, that's how much of our lifespan is actually decided by our genes. According to a huge study called the Danish Twin Study, all the DNA we get from our parents, it only accounts for about 1/5 of our time here. Just think about that for a second. Which, of course, brings us to a much, much bigger question. If our genetics is only 20% of the story, what on earth makes up the other 80%? That's the giant puzzle we are going to piece together today. The answer to that huge 80% question, it lies in this powerful set of factors that shape our lives from the moment we're born. You can think of them as the blueprint for our health, and they have a name, the social determinants of health. Okay, I know social determinants of health sounds a little academic, a little complicated, but it's actually super simple. It just means the conditions where we live, work, and play. It's the reality of your neighborhood, your job, your community. These are the real tools in our health toolkit. So let's open this thing up. We're going to look at 3 main tools. First, our connections. Then we'll get into our surroundings. And after that, our opportunities. And finally, we'll talk about how we can actually start using the toolkit. Let's do it. All right, let's grab our first tool, our connections. And nope, I'm not talking about your Wi-Fi signal. I'm talking about the strength of your relationships with other people, your community. And it turns out this tool is an absolute lifesaver. You know, this idea isn't new. It's ancient wisdom. This quote from Proverbs just nails it. When we give to others, when we refresh them, we get refreshed ourselves. And what's so cool is that modern science is now showing us just how literally true that is. So what does this look like in the real world? Well, take a look at community gardening. One study found that people who gardened together didn't just grow vegetables, they actually ate them way more often. And get this, they were 3.5 times more likely to get their recommended 5 a day. It shows that it's not just about growing food, it's about growing healthy habits together. And the benefits are just profound. Study after study confirms it. Having strong social ties and even just volunteering a little bit is linked to a longer life. You know that warm, fuzzy feeling you get from helping somebody out? That's not just a feeling. That is your health getting a real powerful boost. Okay, on to our second tool, our surroundings. The idea here is really simple, but it's huge. Health is literally built into the world around us. Your neighborhood, the very streets and parks where you live, they have a direct, measurable impact on how well you live. So what does a healthy environment even look like? Well, it's things we might take for granted. Stuff like having a stable, affordable place to live or reliable transportation. But it's also about having safe streets you can walk on and quality parks to enjoy. Each one of these isn't just a nice to have, it's a fundamental piece of your health infrastructure. Let's just zoom in on housing for a second. When housing costs eat up more than half of a family's budget, it forces impossible choices. As you can see here, that money has to come from somewhere, which means cutting back on other essentials like nutritious food or even going to the doctor. The stress of simply paying rent becomes a major health risk. And what about getting around? Well, transportation is way more than just getting from point A to point B. Get a load of this statistic. Just having access to a car can double a family's chances of living in one of the safest neighborhoods in their city. So transportation isn't just about mobility, it's about access to safety and a healthier life. All right, time for our third and final tool in the kit, and this is a big one. It's our opportunities. This is all about the powerful and sometimes devastating link between things like economic stability, jobs, and especially education, and our actual well-being. This chart, wow, it shows a really shocking trend happening in the United States. Since the 1990s, the death rate for adults with a 4-year college degree has been going down. But for adults without one, it's actually been going up. Just let that sink in. We have 2 groups in the same country whose health outcomes are literally heading in opposite directions. The education gap has become a life or death gap. But this isn't just some grim observation. It's a problem we can actually do something about. Research shows that economic policies are, in fact, health policies. A 10% bump in the minimum wage and a tax credit for working families could prevent almost 800 suicides every single year. That's a life-saving intervention that doesn't happen in an emergency room. It happens at the policy level.
Okay, so we've unpacked the toolkit. We've seen the tools, our connections, our surroundings, and our opportunities. They're the real drivers of our health. But, knowing is one thing, doing is another. So how do we actually use these tools? Well, it really starts with a whole new mindset. For so long, our healthcare system has been reactive. It waits for us to get sick, and then it tries to treat the symptoms. The new model, the one that uses this toolkit, is proactive. It uses things like community and opportunity to build health from the very beginning, to stop people from getting sick in the first place.
And this isn't just some feel-good idea. It makes incredible financial sense. Check this out. One report found that investing just $10 per person per year in these kinds of community programs would save the U.S. over $16 billion annually. That's not an expense. That's one of the smartest investments we could possibly make.
So what does this actually look like on the ground? Well, it can start right in the doctor's office by screening people for social needs like, do you have enough food to eat? Then a doctor can actually prescribe resources in the community, not just a pill. Of course, you need partnerships to pay for it all, and crucially, it means we have to address bias in the system so that everyone actually gets a fair shot at being healthy.
And, this might sound like some brand new radical idea, but it's really not. Way back in the 1800s, this physician, Rudolf Virchow, he put it perfectly. He said, medicine is a social science, and politics is nothing else but medicine on a large scale. He knew back then what we're rediscovering today. A society's health is just a reflection of how fair and just that society is.
So, we come all the way back to our toolkit. It's not filled with pills or prescriptions. It's filled with community, with safe streets, with fair opportunities. These are the things that truly build that other 80% of our lives, which really just leaves one last question for all of us. If our health is truly built in our communities, not just in our clinics, what tool will you pick up first?